Mutational, falsetto, and puberphonia. Puber from the root word with puberty. So this is typically seen in males, but it's possible for it to be present with females. It is a psychogenic functional disorder where the person has abnormally high frequency, perhaps akin to like what a child would have, yet this child is going through puberty and their voice should have dropped rapidly by that point. So think of like a 16-year-old male as your hallmark character of this disorder who has 300 hertz frequency of conversational speaking tone. And we remember with children it's 300 to 500, but what is it for adult males? It's like 85 to 155. So 300 is well above 155 and definitely not what a 16-year-old would expect, a 16-year-old male would expect to have at that point in life for his age and gender. An interesting differential kind of piece, a little like test you can do, is have them or observe for them to do vegetative functions. So coughing, for example, which is a vegetative function, coughing with this disorder is done at the typically low voice that would be characteristic of what that person ought to speak. So this person might be talking really high and thinking about all the things he needs to do. And then we're going to go to Disney World. So that's kind of the clue that tips you off that, oh, vocally it's possible. So it isn't that the structures aren't working as intended. It's that something is imposing onto them to disallow that to happen. But functionally, they can actually make that lower pitch. They don't really understand why. He does provide info about it could be like a fear of not wanting to grow up, fear of their voice cracking and being embarrassed, just not allowing those vocal changes. But it's safer to assume that we just don't really understand why this happens, and we want to be careful not to boldly and confidently tell a patient, well, it's because you're refusing to grow up. First off, it's not our scope of practice. It's not our lane to be in. And secondly, there's actually probably not a lot of evidence to suggest that that is the reason. And we just don't quite understand why that is the way that it is. And though etiology helps us understand the disorder and helps us treat it, we just don't happen to know that information, and we can still treat it without really knowing why. So the cool thing about this disorder is this is one of the only disorders in the entire speech and language pathology scope of practice where you can probably cure it in one therapy session. Dr. Bob says that he is surprised when he has to do more than one therapy session to facilitate change here. And basically the therapy for it is using vegetative phonations like coughing as like a starter to kind of show the child that like, yes, you can. This is where your voice would naturally sit, and then somehow works that in. And within one session, they're doing okay, and they maybe only need like a second and third appointment as follow-ups, and then they're discharged. So that is puberphonia.